welcome. Welcome, welcome. I always forget your name. Mary. Hi, Mary. I always forget your name. I'm so sorry. Hi, Mary. Welcome. Hi, Rana. Welcome. Welcome, everybody. So quiet in here. Hi, Ardema. Welcome. I don't think this will be a super long scope, but it should be. It should be longer given the nature of the topic. So, I guess I'll kind of introduce myself because I haven't really introduced myself at all this entire month. So, my name is Marisol, actually. I don't think you guys really even know my real name. And I have late-stage Lyme disease. No, I'm not. Open Bebos? That's a new one. Usually it's open Bobs, but I haven't heard open Bebos. So I have late-stage Lyme disease. I know, I think I got a troll in here. I'm new to trolls. I actually rarely get any trolls, but I've been getting some in the last few broadcasts. So I have late-stage Lyme disease. If you guys want more information about the specifics, you can check out my other broadcasts that are saved here. Or you can visit youcaring.com/Marisol has Lyme, where I am accepting donations until the end of May. Yeah, they're funny sometimes, but sometimes they're distracting. So yeah, you can go to my You Caring fundraising page to get more information and check out my other broadcasts. So I'm kind of out of it today. I feel a little out of it. Like I wasn't fully ready for this broadcast, but let's see, yesterday my broadcast was about, let me see if I can remember. What was my broadcast about yesterday? I can't remember what I broadcasted about yesterday. Wow. Okay. So I did an injection yesterday. I did an injection yesterday. I did a methylcobalamin, which is vitamin B12 injection. And that injection helps with some of my neurological symptoms, to sort of calm them down a little bit. Doesn't resolve them, but it calms them down a bit. And it also helps with energy. So it kind of keeps my energy up. So I talked a little bit about that yesterday. And then on Sunday, I had talked about some severe neurological stuff that I have going on the right side of my body. So today, there's still even more neurological issues that come with Lyme disease, but they're sort of the lesser known issues. And these are the neuropsychiatric issues that accompany Lyme disease. I think on Saturday I was talking about celebrities that have Lyme, and I spoke about Allie Hilfiger, who was at the Grove in Los Angeles, I think on Sunday, I think she was there on Saturday night. And she was actually institutionalized because her psychiatric symptoms from her Lyme disease were so severe. But she didn't know at the time that she had Lyme disease. So she was institutionalized, and while she was institutionalized, I think somebody in the institution told her, it's horrible. I mean, I can't imagine what that's like. But while she was institutionalized, somebody there at the institution, I think one of the nurses or doctors there, I think sort of put the pieces together and told her that she may have Lyme disease. And then she got checked for it, and she did in fact have Lyme disease. So what I want to talk about is the neuropsychiatric symptoms that come with Lyme disease. A lot of people think that it's, you have psychological issues because you're sick. Like you're depressed because you're sick and you can't do, hi, NK and poor. You're depressed because you can't go out, or because you feel tired all the time and stuff like that. But it's actually not, That's part of it, and I did talk about that before in a previous scope, that, you know, there are things that people say to you that make you depressed, or, you know, you're isolated, so that makes you depressed and people don't believe you. But there's also the actual impact of the disease on your brain. You know, there was a gentleman at one of the support groups that, one of the Lyme support groups that I used to go to, and he was a recovering alcoholic. But he said that when he would get treatment, when he would get a specific treatment for Lyme disease, right after he was done with that treatment, he would get cravings for alcohol, and he would kind of go on an alcoholic binge. So can it cause alcoholism? No, but I think if you do have issues with alcohol, it can actually make those worse. If you still tolerate alcohol. I don't tolerate alcohol very well, but I used to be kind of a big drinker in the past, and I'm lucky that I don't tolerate alcohol very, very well, because if I could, trust me, I would be drinking quite a bit. Hi, Boytech, welcome. So I don't think, I mean, it can do, it can do a lot of things, though. I wouldn't doubt it. Hi, Boytech, how are you? But I'm going to go through some of those symptoms. So the first thing that I want to show you guys is actually something called a Spect Scan. And I forgot what that, it stands for something computed tomography. I should have looked it up. But actually, a Spect Scan is, I want to say it's similar to an MRI, but not exactly the same thing. Instead of putting you inside a tube, they lay you on that bed thing, and these panels rotate around your head. So you're still supposed to be very still. These panels rotate around your head, and they take these 3D images of your brain. And basically, it's supposed to see where your brain has like limited activity or overactivity. Spect scans are usually used for people that have ADHD. They were, I think, perfected for that disorder, but they've also been used for many other psychiatric conditions, and more recently have been used in military veterans that have had head trauma, football players that have had head trauma, and people that suffer from Lyme disease. So these were the results of, I don't really know how to interpret this stuff. So I'm going to try to show you the pictures, but without showing my personal information on the top. So right here, we have this one. So that little, that yellow rectangle shows where there's something going on there. I think it's called hypoperfusion, where there's like limited oxygen flow, and you kind of get that weird chunky look on the bottom of the brain. And then there are these other ones here, but I don't know, none of those are circled. And I think these, there's a little red arrow pointing at something there. I'm not a doctor, so I don't know how to interpret these, but I'll read you the interpretation afterwards. And these here. These are really cool. These are super colorful. So that's my brain, more or less. So what do those pictures mean? So those pictures basically mean when they do this Spect Scan, they get the pictures, and then the pictures are given to a doctor, and that doctor interprets the results. I know, I wish I did too, but you know what? I've had Lyme disease for such a long time that if I would have had the scan within the last 10 or 11 years, it probably would have come back abnormal in some way. But this is actually probably the most severe my brain was. These images were taken in the summer of 2013, so that was already almost 3 years ago. And that was, I think, right in the middle of my treatment. I think I was still undergoing antibiotic treatment at that time. So it should have been at the peak of my treatment, actually. So probably at my very, very worst period of illness. So basically, this is the interpretation of the pictures that I just showed you guys. I'm going to read, some of it is kind of like very medical mumbo jumbo. So I'm going to kind of try to skip around that. So findings. There is moderate asymmetric decreased uptake in the temporal lobes, worse on the left, and of the orbitofrontal regions of the frontal lobes, more prominent on the right. This is observed on the isocontour Th1, Th2 images of the something views, blah, blah, blah. The cortical 3D perfusion image posterior, right and left views show decreased uptake in the parietal and occipital lobes. So I believe that's underneath the brain. I think that was under that bottom picture that I showed you guys, the first one with the yellow rectangle around it. Transverse cross-sectional images 60 through 67 show asymmetric increased uptake in the thalamic nuclei and more symmetrical similar level of increased uptake in the basal ganglia. Lateral ventricular size appears within normal limits. There is no decreased uptake in the proximal brainstem. So images 60 through 67. Let me see if I can find this. I know this is kind of boring. 60 through 67. Okay. It doesn't really show. It would be these, I think. through 67 would be these down here. Can you guys hear the dog? I'm going to close the door if you guys can hear. So, basically, in English, this is what this means. So, what it means is there is moderate asymmetric hyperperfusion of the temporal lobes. I believe the temporal lobes are these on the side. And that means that I have a closed head trauma. Hi, Mary. Welcome. So basically, the asymmetric hyperperfusion of the temporal lobes is indicative of a mild traumatic brain injury. So like mild head trauma, like I got hit in the head. But it can also be a result of neurotoxic, infectious, and autoimmunologic processes. So it can be head trauma, neurotoxins like mold, infectious diseases like Lyme disease, or neuroimmunological processes, an autoimmune condition. So that's what that means. Concerning the orbitofrontal hyperperfusion, which I believe is what is going on in the front, this can be associated with executive dysfunction. So basically, forgetfulness, like I just did right now. Like I said before, this test, the Spect Scan, is usually not covered by insurance, but my doctor found a way to get it covered by insurance. But usually it's not. I don't know how she did it. I don't know what she did. I don't question her, or I didn't question her until recently. But she was able to get it covered by insurance, but typically it is not. Yeah, you know, some doctors know what to do to get it covered by insurance. She was very, very good at that, but you also have to have decent insurance. At the time, I had pretty decent insurance. Right now, I'm on Medicare, so you're not going to get anything covered by Medicare, basically. So executive dysfunction, and I will talk about executive dysfunction. So short-term memory issues, decision-making processes, things like that. Asymmetric hyperperfusion of the thalamic nuclei, which I don't know where that is, especially when concomitant with prefrontal cortical hyperperfusion, can be associated with mood dysregulation. So I have a hard time controlling my moods. Hi, Christina. Welcome. I always forget your name too. See, I'm not good with remembering names. Hi, Christina. Mood dysregulation issues. So kind of happy, sad, angry, calm, just kind of up and down like that. I wouldn't say that I'm necessarily like that, but I do have my moments. I don't think I have very severe mood dysregulation. Yeah, some people do though. Some people have very, their moods tend to fluctuate quite a bit. This one I do agree with. Hyperperfusion of the basal ganglia is frequently clinically associated with anxiety-like tendencies. I know, yeah. I don't remember. Sometimes I don't even remember faces, and we'll talk about that too. So I do have anxiety, and I'll definitely tell you guys about that. So as a brain region function procedure, the Spect Scan shows areas of increased and decreased function that can be compatible with clinical signs and symptoms. Correlation with those findings is required. So also too, because of the limited blood flow in the front part of the brain, they also concluded that could also be part of the reason why I have the light sensitivity. How do you get tested for Lyme? You have to go to a Lyme literate physician, preferably an ILADS trained physician, and they know which laboratories to send your blood test to, but it's all out of pocket. You can't go to Quest or to, your run-of-the-mill blood testing facility to get tested for Lyme. You have to send it out to specific facilities that have different types of testing, and that's how I was tested. So, okay, so that's my brain scan. That's all the fancy mumbo-jumbo. Now we're going to get into the actual non-medical terms. So neuropsychiatric symptoms of Lyme disease. Yes, it can be very expensive. It was a few hundred for my blood test. But that's because it has to be prepared. It has to be basically flown to the facility because the facility was on the East Coast. And of course, everything is not covered by insurance because it's not an FDA approved blood test. It's called polyclonal reaction testing, PCR, I believe. But I'm not 100% sure, so you might want to look it up. So the cognitive symptoms, so this is where, your executive function issues can go wrong. Simple and complex attention. So basically paying attention. I've noticed that when I'm in a conversation with someone, if the conversation is going for a while, I have a really hard time holding on to focus and really just paying attention to them. So that I can tell I do have an issue with that. Slow processing, visual and auditory. So that, I think I talked about how I couldn't recognize my phone ringtone one time. So that would be auditory processing issues. Visual, when you can't recognize faces. Visual spatial difficulties, trouble finding things, getting lost. I talked about the phone, that I lost recognition of my phone. Visual and spatial. I also told you guys that every time I would put a cup in the cabinet, I would hit the shelf. For some reason, I'm looking at the cabinet and I'm reaching to put the glass on the shelf, and I would always hit the shelf with my hand. I also sometimes would run into the doorway. Let's see, for example, can you guys see the doorway? My phone's gonna fall off. So I would go through a doorway, and I would always hit the side. So I would always hit this side. I wouldn't run into the door, but I would always hit the side of the doorway or a passageway, wherever I was going, wherever I was walking through, I would always hit it or run into it. That's gotten better. Some of these things have actually gotten better since treatment, so I think that's interesting. Some things get better, some things don't. Auditory processing, visual processing, sensory integration disorders. So you'll see a lot of kids with autism have this. They don't like being touched or squeezed. this jerk where I used to work made fun of me for that. Yeah. My ex-husband would laugh, and I'm just like, I mean, at the time I was like, I don't really know, but he would laugh. He would think it was funny, and it's like, well, I can't help it. But that's what happens. Your spatial skills kind of go out the window. I mean, it's really weird because you can't tell that there's something wrong with you. You just keep running into things, and I would drop things too. I've broken so many glasses. It's ridiculous. So sensory integration, like I said, kids with autism have a lot of sensory integration problems. Also people with ADHD. My ex-husband had ADHD, and he just had a lot of sensory issues. Anything greasy would bother him. If he had any kind of grease on his hands, on his body. Tags, like if you have a tag on your shirt, that drives people with ADD mad. I mean, it drives them up the wall. And I have something similar to that, where if I have clothing that's very snug, especially on my thoracic area, I talked to you guys about the issues that I have in my thoracic area this weekend. If I have anything that's just really tight, like a very fitted t-shirt, it drives me crazy. I can't stand that sensation. The sleeves on this shirt are kind of snug for me. I'm hoping that they'll loosen up as I wear the shirt, but I'm really skinny, so I bought an extra small shirt, but it drives me up the wall for the sleeves to be so tight on my arms. So I think they'll loosen up because it's a cotton shirt, but that sensation of just having stuff kind of stuck on my body. Thank you. Yeah, I'm also wearing red pants today, so and also too, I cannot have a tight waistband. It drives me nuts. Jeans are actually these are kind of a little bit loose on me, but jeans that are, I know, right? I get all of my fashion tips from Pinterest, but anything that is just a little too tight, jeans, even if the jeans aren't tight for some reason, I think just the heavy weight of the material kind of drives me kind of crazy. And I've heard other people with Lyme disease say the same thing, that they can't wear jeans at all. They have to wear like sweatpants or like slacks. They have to wear slacks because the jeans just kind of drive them crazy. So that's like sensory issues, hearing problems. Light sensitivity, of course, is another sensory issue. Short-term and working memory difficulties. So, some people do complain about phantom itchiness. I think I had that a little bit. Yeah. You may just have sensory issues. It could be related to Lyme. It could be related to something else. Like I said, the itchiness, yeah, a lot of people with Lyme disease have that weird phantom itchiness. I sometimes get it where I'll get itchy, but I also have eczema, so that can make you itchy as well. But yeah, the phantom itchiness I've heard quite a bit from different people. Short-term and working memory problems. I remember when I was living in an apartment, every single time I would go get the mail, I would lock my door, I would walk out my door, I would go get the mail, I would come back to my apartment and automatically try to open the door, even though I had locked it. I would do this every single time. Come back, try to open the door. Yes, short-term memory issues are, I think every person with Lyme has short-term memory issues. Hi, Lawrence, welcome. So, without fail, I would always try to open the door without unlocking it first, every single time. Another thing I would do is I would take out the trash. I would take the bag, tie it, take the garbage out to the dumpster, throw it away, come back inside, sit down, read a book, do something else. Then suddenly I would go in the kitchen. It's from a tick, yes. Some people, there are theories that it may come from like mosquitoes or other things, but so far the only thing that has been proven is that it does come from a tick bite. They have not yet shown that it comes from the bite of any other insect. So that's sort of still under investigation. But I would get my trash, take it out, come back inside, sit down, read, do something else until I walked into the kitchen and realized I did not put another bag in the trash can. Every single time. Every single time I would take out the trash. And I would have just other memory issues. Could never remember directions anywhere. I always have to have the directions to where I'm going written down on a piece of paper. And I have to constantly look at it. I can't remember just by looking at it, oh, my next turn is here, my next turn is there. I constantly have to be looking at it, which is very dangerous when you're driving. So that's kind of a problem for me. Hi, Hurricane. Hi, welcome. So, word finding, word generation, and communication difficulties. A GPS. I use my phone now. Yeah, I have pretty decent GPS on my phone now, so that works. No, because I'm diagnosed. I wouldn't be overthinking things. With the directions or just in general? Because these are things that actually did happen to me. I lost recognition of my phone. Thank you for the hearts. I did lose recognition of my phone ringtone at one point, which, I used to hear my phone ring all the time, so that's kind of bizarre. Word finding, word generation, and communication difficulties. I know, right? I would be having a conversation with my husband, and suddenly I was just like at a loss for words. Yes, brain fog is not fun. Brain fog is not fun at all. So I would just forget the word or forget what I was saying. One time I was on the phone with my brother. I was talking, and all of a sudden it was like, what was I talking about? Yeah. People are going to question your symptoms. They're going to question whether you really are suffering from something or not. So, I'm used to it. My family has questioned whether I'm sick, for the last decade. Even after I gave them a blood test, they still question it. And I think that's just part of having an invisible illness, is people questioning you. Decline in executive functions, planning and organization, confusion, decline in overall intellectual performance. So sometimes, I would get confused. Decline in executive functions. I'm not as organized or as tidy as I used to be. I used to be very, very organized and tidy. That's where my family is concerned. Yes, you're very fortunate. You're very fortunate if your family believes you and if your family is on board with you. Consider yourself very extremely lucky. Yeah. Hi, Dianica. Welcome. Thank you for the hearts. So yeah, I used to be very hyper organized, very motivated, very tidy, and now just the thought of having to clean up and do stuff like that is just, it's hard for me. Hi, Dianica. Welcome. So now let's get into the actual psychological stuff, the neuropsychiatric thing. Yeah, it's tiring. Physically I don't have severe fatigue, but it's like mentally when I have to start thinking, okay, I have to clean the bathroom, or I have to do my bed, I have to organize my side table. You guys have seen my side table in my room on some of my scopes, and just the mountain of crap that's on there. It doesn't take a lot of effort to clean it. I can sit on the edge of my bed and organize it. It's just getting there. Yeah, I do kind of have energy. I'm not as bad as some other people. Like, I've heard people with lupus and Lyme that can't even get out of bed. I'm not at that point where I've gotten that bad, but it's my brain. It's like my brain is tired in a way. Just the thought of I have to organize this, it gives me anxiety. It makes me feel like I don't even want to face it. I don't even want to deal with it. So I think it is sort of a psychiatric thing. It's a bed day for you. Yeah, I don't typically have days where I'm stuck in bed. I'm stuck at home because I have, the severe light sensitivity. But, I can walk. I go for a 40 to 45 minute walk every day. Yes, some people get to the point where they can't get out of bed. I've known a few people with Lyme that were bedridden until they went through treatment. I'm fortunate that I'm not one of those people, but then at the same time, it's like my brain is so done, So here are the neuropsychiatric stuff, the more psychological things that can happen to you. Anxiety with panic attacks. I get that a lot, especially at the end of last year. I had a really bad year. I was waking up to severe panic, paranoia. I do get kind of paranoid. And just, that crazy anxiety. Yeah. There are days when you just don't feel like going anywhere. Like, I did a scope on Sunday where I had a game group and I just wasn't feeling great. I think it was a combination of symptoms and anxiety. Hi, Michael SoCal. Depression. Depression is one that's a huge one for people with Lyme. Right. And if you don't feel like going, don't force yourself. Even if you're not symptomatic, if you just don't feel like going, don't force yourself to do it. Yeah. You know what? I stopped caring whether my mom was mad at me or not, It's easier said than done, though. Irritability, rage, attacks, impulse, discontrol, violent behavior, and oppositional defiant disorder. I'm not at that point yet, but I know some children that have Lyme can exhibit some of these symptoms. Like I said, Allie Hilfiger was institutionalized because of her psychiatric symptoms. Yes, it's hard to say no, but listen to your body for sure. Sleep disorders, insomnia. I go through periods where I don't sleep very well. I've been sleeping okay lately, but I do go through periods regularly where I have a hard time falling asleep, and then I also wake up very early in the morning. Rapid mood swings. We were just talking about this. Like they can mimic bipolar disorder. Lupus and Lyme are very, very similar. Menstrual pain can be off the charts. It can be off the charts for sure. OCD, hyperactivity, autism spectrum-like disorders, and I talked about that in my autism scope, or my autism and Lyme scope. Antisocial disorders and eating disorders have all been associated with psychiatric symptoms of Lyme. Yes, I actually, right before I got diagnosed, I went to the hospital for severe, dysmenorrhea, which is, I think, severe menstrual pain. Yes, she should understand that you're not feeling well, but unfortunately, some of our family members will not understand. And I did talk about that also in another scope. So my old scopes are actually up on YouTube. I got to get that link for you guys. You went through menopause early. That's another issue as well that can come with Lyme disease is infertility and just no menstruation at all. Yeah, hysterectomy. That's another subject. That's very female specific. But yeah, some of our families are not exactly supportive. So it depends, on how your parents are. Endometriosis can happen. So I want to talk about some of my psychiatric symptoms. It's good that you had your kids before. I'm 31, no kids. I never really had any plans of having kids, but I think at this point it's pretty much a done deal. So I don't really have that option anymore. Some of my major psychiatric symptoms are anxiety. That's one of my biggest ones. Something that has been happening to me recently is I go for a walk every day around the neighborhood, about 40 to 45 minutes. Like I said, I'm fortunate that I can still walk and I can still do that daily. But I've been having this issue. You're going to adopt. I'm just going to stay away from the whole kid situation. I can barely wipe my own ass, as some people say. I don't know what my life would have been like if I would have had small children right now. And I've seen people with Lyme disease that have small kids, and my heart goes out to them, to be honest. The gentleman that I was talking about that suffers from alcoholism and Lyme disease, he has 2 little ones and a wife, and he's the sole provider of the family. A partner from by myself. Yeah. If you have a partner, that's good. Your kids are grown, that's great. I'm just like, I can't even imagine. What that's like. So I'll be going for my walk, and sometimes there's sidewalk here in California. Sometimes you have a piece of sidewalk that you can walk on. Sometimes there's just the person's yard goes all the way to the edge. When there's a sidewalk, I'll walk on the sidewalk because it's safer than walking in the street. But then you're also walking by everybody's driveway. And lately I've been getting really, really anxious because I have my headphones on and I'm listening to music. So I've been getting really anxious that I'm not going to hear a car backing out of their driveway and that they're going to run over me. And, you know, I'll walk past the driveway in the car, and all of a sudden I'm just overcome with this bad anxiety that that the next time I go for a walk, they're going to back out and they're going to run me over. And of course, the next day that I go for my walk, I forget and the process starts all over again. I'll walk by a car and I'll be fine. You know, I walked past the car already, and all of a sudden it's like, if you don't pay attention next time, the car's going to back out and it's going to run you over and kill you. And the last few times that I've gone for my walk, that's happened to me, and I'm just, you know, it's weird. It's really weird. I don't know why that's happening. I also get this, I don't take any medication, actually. I take zero medication. I'm intolerant to almost everything, and I'll be talking about that on Sunday. I'm intolerant to almost all foods and all medications. So I can't take any types of drugs. I can take a few, but nothing really by prescription. And like I said, on Sunday, I'm going to talk about that. That's one of my worst, probably the most damaging symptom that I have with this disease. Hi, Wilson. Welcome. So the anxiety, what was I going to say? I was going to say, I also get the feeling about the food sensitivities. I also get the feeling that I'm going insane. So I'll be sitting and just all of a sudden it's like I'm going to go crazy. Holistic, yeah. No meds. Yeah, I'll talk to you guys about that on Sunday, about the lack of medication. Or you can message me on Twitter. Some people with Lyme disease have that issue. Other people do not. So I'll just be sitting there and suddenly I get this feeling like I'm going to go insane. I'm going to go insane. I'm going to lose my mind right now. I'm going to go insane. And I sort of have to talk myself off of the ledge and bring myself back down. I don't know how I do it. I just do. I've had anxiety since I was a child, so I don't know if that's just part of just what I've had since forever, but I think my Lyme has made it worse. And that sensation of I'm going insane is kind of a newer thing. They figured out about not being able to take meds. Genetic testing. So my doctor was very thorough. She did genetic testing and she found out that I had a multi-susceptible gene, and that makes me intolerant to a lot of things. And I will talk to you guys in depth about that probably this coming Sunday. Sleep disorders, like I said, I have insomnia, I have a very difficult time falling asleep, and then I wake up very early. And I do have episodes where I will not sleep at all. And that's when I have to take something. And like I said, I'm intolerant to most medications. But I do tolerate, Benadryl and stuff like that. Cool. Yes, anxiety. I've always had anxiety, but if it's new for you, it's gotta be, horrible. I can't imagine somebody that's never had anxiety to suddenly have anxiety. I've had it all my life, so I've been learning how to cope with it since I was a child, which I guess I'm lucky in that way that I was always coping with it, but now it's just like another level. The depression is also another level. I cannot tell you, I thought I was depressed before. It freaks me out. I breathe through it. Yeah, sometimes you gotta breathe through it, but then you have to be careful not to breathe too much, because then when you're breathing a lot, it makes you more anxious. Yes, panic attacks. I've suffered from panic attacks since I was a kid. A death in the family is definitely going to make that worse. A chronic illness is going to just compound on that issue. The depression is another level. I have never experienced a depression this severe and this bad in my life. I think I've suffered from depression since I was a kid. Like I said, I've always had family issues, and I think that's where my depression and anxiety came from. But with this disease, it's a depression that you feel can kill you. Just the depression alone and the sensation of that depression. There are days when I think, I'm going to die of depression. Like I can physically die just from how bad this depression feels. And I've never had that before. Yes, like I feel the pressure in my chest, and the sadness is so profound that it's just going to kill me. Like I'm just going to spontaneously die right now because this depression is so horribly bad. And that's a whole other level. When I was younger, the depression manifested more as I feel sorry for myself or I hate myself, that kind of thing. Like it was a very teenager, very hormonal type of depression. Now it's just a flat out, I'm gonna die, this feeling is so horrible. It's not like a suicidal thing, although there is a lot of suicidal ideation with the depression, but it's just the depression alone can kill me. Yeah, I think if you have Lyme disease, this is one of like, a hallmark of neuropsychiatric Lyme. It's just this depression where, I'm just gonna drop dead right now because it feels so horrible. I mean, it's like a sensation of, this is sticking on me and I want it to go away. Kind of like how I was talking about with the t-shirt, that the t-shirt is just so snug on me, I just want to get it off. And that's the type of depression that this feels like. I just want to get it off, and I will do anything to get this depression off of me. It is just such a gross, unsettling feeling. It's indescribable. I've actually been researching a lot into other mental health issues, such as like borderline personality, narcissistic personality, and things like that. And I'm noticing a lot of similar symptoms. I've been reading a lot about borderline personality lately, and the severe, intense mood fluctuations, and actually just the intense emotions and feelings that come with borderline, I feel can also translate a lot to Lyme disease. And so I'm looking into the types of therapy that they provide for those people. Great coping skills. Yes. You seem to have a pretty decent handle on the emotional aspects, which I'm still, right now trying to get a hold of, because my illness has gotten to a point where it is very debilitating in some ways. I'm very isolated, but I also had some issues with my doctor last year, and that sent me on a complete tailspin. I mean, I was at my lowest point in December and January. Okay, I'll be here. I was at my lowest point in December and January because my doctor dropped me, and I was just, the depression and anxiety was through the roof. And so right now I'm trying to figure out, yes. She was a very skilled physician. She knows a lot about the illness, and she was very good, actually. I do want to talk about it, but it's still it's a huge trigger for me. And like I said, she was a very skilled physician, and the fact that, she couldn't figure this out was really, really bad for me. And that sent me into a total tailspin of anxiety and depression. So right now I'm sort of, yes, you fired a few doctors. And I didn't fire her. She kind of fired me. But at the same time, I think we both knew that there was nothing else that could be done for me. So that's kind of where I'm at. And so I'm trying to learn different methods of coping. And because my emotions and my moods have been so intense, I think I need some kind of therapy that's a little bit more intense. And that's why I've been looking into methods that are used for people that have these serious psychiatric issues, sort of like borderline personality and also attention deficit disorder. Those are really severe issues that that require some more in-depth coping skills. I was diagnosed in 2012, I believe, so it's going to be 4 years this September since my diagnosis. I went through a lot of treatment. I was with this last doctor for about 3 years. The last year was a total waste of time, but she put me through the whole treatment and I did not improve. So that is, where I'm at. So I had really severe depression, and tomorrow I think I'll talk about ways to cope that we can do ourselves. So those are my issues. I wouldn't say that I have antisocial disorder, but I am antisocial as a result of my illness. Being that I can't do a lot of things, that I avoid people sometimes, just because I don't want to be judged. Mood swings, I wouldn't say that I have mood swings, but I have intense moods. So that can be pretty tough. So, OCD, I think OCD can be an issue with people that have Lyme. I'm very routined. Yes, I think my immune system plays a huge part in it. So I think I'll do a scope about that when I'm having a good day. So, but yeah, my immune system is a mess. It's totally broken right now. But anyways, there's a lot of noise going on now. My alarm is going off. My dog is barking. So I think I gotta call it right now. But I think tomorrow I'll discuss this more in depth and maybe ways that we can cope and things that I've found that I think might be effective for, at least for my case. And we'll talk about those tomorrow. Yes, good luck with the doctor. Yeah, good luck with the doctor. And, my situation is worst case scenario. I will tell you that much. My situation is worst case scenario. Most of the people that I've talked to with Lyme, they're recovering or they've improved. And I have improved. Hi, Silos, welcome. Yeah, I have improved a bit. The doctor wasn't a complete loss. She did help me in a lot of ways, and I still continue to do a lot of the things that she recommended. But like I said, it's not a total loss. If you're at the beginning of your journey, I think you'll be okay. A lot of people do get better. It's worth at least giving it a shot, in my opinion. I gave it a shot. I went through the whole entire treatment. I was very diligent. So at least I know that didn't work for me. Hi, Carol. Welcome. So, now I'm exploring other things, but, at the same time, I have to make peace with whatever is going on with me. So, like I said, I gotta go. The dog is making a lot of noise. I'll come back tomorrow. We'll talk about this more, and we'll talk about coping skills and things like that. Alternative treatments, I do some supplements, but I don't tolerate a lot. So, but like I said, visit my YouCaring page, youcaring.com/Marisol has Lyme. Please share it with your friends. I'm accepting donations through the month of May to pay off debt. And also follow me on Twitter, HotSun100384. If you have any other questions, you can ask me questions through there. I might have a blog coming soon. Not Lyme related, but it's also a place where you can probably get in touch with me as well. But I'm still working that out. And I also have the YouTube page, and I still got to get the link for you guys because the link was too long to put on my profile. So check that out. I will be back tomorrow with another topic, and I will see you guys again soon.